So let me just quickly introduce all the panelists first, and then I'll start by asking Heidi to speak. So first of all, I was just saying, as you joined us, Shalmali Guttal is the Executive Director of Focus on the Global South, which is, for many years, has been one of Global Justice Now's key allies in Asia. Normally, Shalmali's based at Focus's HQ in Bangkok, but for reasons relating to the coronavirus crisis, she's now in rural India, somewhere in the vicinity of Bangalore. Is that right, Shalmali?
Actually, no, in the vicinity of Goa, in the south.
Oh,
not,
okay.
Not far away.
Yeah.
But in the south of India.
Right. So, we weren't sure that the internet was going to work as well as it does at the moment seem to be working. So that's great. And then we've also got Nick Dearden, who's the director of Global Justice Now. Many of you may know already, have heard him speak already. Our first speaker, in terms of the order they're going to speak, is Heidi Chow, who's our pharmaceuticals campaigner, amongst other things. So she, while some of us at Global Justice Now have had less that we can do, Heidi's had a lot more to do recently. So I'm going to start by asking Heidi to speak about some of that work. Because for a couple of years now we've been campaigning on the pharmaceutical industry and the problematic level of corporate power that there is over the production of drugs and so on. So very relevant to the crisis we now find ourselves in. So Heidi.
Thanks, James. So yeah, good morning, everyone. It's really great to be able to speak this morning at our online conference, and it's great to see so many people from across the UK and indeed across the world joining in with this conference. So in the UK here, we've been in lockdown for almost a week now, and there's a lot of speculation about how long this will last and whether this will become the norm for us for quite some time. But even though the lockdown has been introduced to slow down the transmission of the coronavirus, actually the only real long-term solution for us for dealing with this pandemic is actually to develop a vaccine. And so all the governments are now pinning their hopes on seeing a successful vaccine developed. And it's already been reported that there has been some promising progress to get us there. This month, some human trials have already begun in the US. But still, experts are predicting that a vaccine is still 12 to 18 months away. But what you might not have seen reported as much is the role that public funding plays in vaccine development. What you might not have seen reported is that the public funding does not necessarily mean that people will be able to access that final product. In fact, there's a real danger that in spite of the public money going into the research for a coronavirus vaccine, we could well end up with a vaccine that's priced so high that that would prevent the widespread availability of this much needed vaccine. And as history shows us, actually, vaccine distribution has often been based on wealth and power. So I'm going to just spend the next sort of 15, 20 minutes or so just talking about how this can happen, what are the issues and what we can do about it. So when it comes down to it, essentially we have a pharmaceutical system that's driven by profits and not by public health needs. Big Pharma investment decisions are based on the areas of greatest profitability rather than the areas of greatest health needs. So for example, in the world today, only 4% of new drugs are for conditions that affect people in the global south. In other words, for Big Pharma, because they're completely driven by financial returns and profits, actually these markets are basically too poor for them to make a profit from. And instead, what we're seeing is that Big Pharma prefer to invest in what they consider to be profitable areas. For example, developing drugs for chronic diseases like diabetes and cancer. Goldman Sachs, the investment bank, did a consultancy report for the biotech industry where they even asked the question, is curing patients a sustainable business model? And so instead of investing in research for genuine breakthroughs, what we're seeing is about over 51% of new drugs are basically just modifications of existing drugs. And so they don't really deliver any additional health benefit over and above what is already out there. And that's because the returns are much higher if you just tweak existing products rather than investing that money into breakthrough research. Big Pharma also spend more on marketing than they do on research development. And they also spend more on buying back their own shares than they do on research and development. So this helps basically with their own, to raise their own share value in the financial markets. But spending all this money actually isn't actually committing proper and actual investment into health innovation. So increasingly what we're seeing is that Big Pharma are leaving the research stage of drug development to public researchers, public research institutions, and universities. Estimates show that about 1/3 to 2/3 of all research and development globally is funded by public money. Now, conducting research is the high risk end of the drug development process because there are really high levels of failure and high levels of uncertainty. Scientists often describe this part of the research process as searching for a needle in a haystack. And so what often happens is that the new discoveries are based on research which is done by the public sector. That research then gets patented by big pharmaceutical companies who then go on to conduct the later stage trials and then go on to market that final product. And they are therefore able to charge really high prices for the final product. And the way they do that is through the granting of intellectual property rights. Patents provide monopoly protection over new drugs. So this means that no other company can buy or sell that drug for a minimum of 20 years. And so with no competition, drug companies are essentially able to charge whatever they want for drugs, treatments, and vaccines, even when they've been developed with public money. So this means that the risks of drug development are socialized while the rewards are privatized. And so this system leaves the taxpayer to pay twice, first for the research and then in high prices for the final product. Now in the UK, the NHS drugs bill has risen 22% in the last 5 years. And so what we're finding is that even though in the UK, patients don't directly pay for medicines and vaccines and treatments, the NHS, who has to buy in these treatments and medicines, are increasingly having to reject or ration new and effective drugs simply because they're just too expensive. The prices that Big Pharma are charging are just too high. And so we've been critiquing this broken system for the last few years because it's a system that is not geared for delivering on public health because it's driven completely by profit. We believe that access to medicines is really essential to achieve the right to health. And so things like drugs and treatments, they're not just consumer luxuries like handbags or trainers that you can walk away from if the price is too high. But they're like I said, they're part of that essential right to health that we all should have. And so in the UK, we believe in a universal healthcare system, and that's why we have the NHS. But essentially, what we have is privatized medicines within our socialized healthcare system. But I think maybe the most shocking part of this whole profit-driven system is actually the deadly consequences that it has, and we see that especially during times of public health crises. We see this tension between profit and public health really play out. So I'm just going to give you some examples of this. So back in the 1980s and 1990s, during the HIV/AIDS epidemic, there was a real breakthrough in a drug that could treat some of the symptoms of HIV/AIDS and help prolong people's lives, and that came out in 1996. And these drugs were launched with a really high price tag, and so only people in rich countries like the US and the UK could access these drugs. And actually, many people, especially in the global south, couldn't get hold of these drugs because they were priced so high. And so millions of people died unnecessarily, especially in sub-Saharan Africa. We're currently facing an antimicrobial resistance crisis. And so the antibiotics that we have are not working anymore because we're becoming immune to them. And yet Big Pharma are not investing in developing a new class of antibiotics. And the reason for that is because the market for any new bioantibiotics will be shrinking, will be very small, because any new antibiotics will be reserved as the drug of last resort. And so Big Pharma have showed no interest in investing in this massive existential crisis almost around developing a new class of antibiotics. The Ebola outbreak in 2014. Now, prior to the Ebola outbreak in 2014, actually, Ebola was considered to be an infectious disease causing only small-scale outbreaks in the poorer, more rural communities in Central Africa. And so Big Pharma saw no commercial interest in investing in this infectious disease. But a Canadian government laboratory had actually developed a potentially effective vaccine for Ebola years before the outbreak. And in 2010, it licensed that vaccine to a small biotech firm to develop that vaccine. But then the biotech firm couldn't continue with the funding for it because of the lack of commercial interest. And so the testing work was never done. And instead that vaccine discovery was left on the shelf. So when the epidemic broke out in 2014, there was no readily available vaccine to be used. And so in the end, the Ebola epidemic killed over 11,000 people. Eventually, during the epidemic, the license was taken on by another pharmaceutical company, Merck, who undertook human trials during that epidemic, and then continued to develop that drug. But mostly because of the massive funding injection it was given by the US government. So eventually a vaccine was approved last year for Ebola, but that only happened because of the public funding from governments and philanthropic funders. And then SARS. So actually what happened about 3 years ago, 2016, the US public investment was poured into a potential SARS vaccine. And the genome of SARS has a 86% similarity with the COVID-19 virus. And therefore, actually, the SARS vaccine would have been a potential coronavirus vaccine. But then, even though this SARS vaccine showed potential back in 2016, because SARS was no longer a public health threat, it'd been contained, officially declared as contained in 2003 by the WHO, there was basically no more investment or interest in clinical trials or getting the vaccine to market. And one of the leading scientists on this SARS vaccine project actually recently gave testimony in Congress a couple of weeks ago, and he said that had this vaccine been continued to be worked on, invested in, tested, actually we would have had a coronavirus vaccine at the beginning of the outbreak in China in January. And then this week we've heard news about an American big pharma company called Gilead, who've been testing an existing drug, one of their existing HIV drugs, to use as an antiviral for COVID-19. And what they tried to do was they managed to secure something called orphan status in the US for that drug. And when you classify, and orphan status basically means when you classify that drug to be used for rare diseases. Now, obviously, COVID-19 is almost like the opposite of a rare disease. But the reason why they classified it as a rare disease was because when you classify it in that way, and prior to the numbers of people who's been affected by that disease, they would have been able to secure a 7-year market exclusivity on top of their existing patents. So that would be basically giving them even longer monopoly protection than what they already have with their patents. So what they were trying to do was basically to lock out all competition at this early stage of the epidemic so that they could corner the market and rake in the profits. Gilead has actually since rescinded and pulled away from that orphan status, I think partly because of the massive outrage that happened when campaigners found out about what they had done. But still, I think it shows where the instincts are lying with big pharma companies around developing COVID-19 treatments and vaccines. So public funding has played a really big role to try to plug the gaps where big pharma has not stepped up, especially where, like in some of these other examples I've shared, about how the lack of commercial interest has meant that they have not been interested to invest in this area. And the vaccine business in particular is risky, and so big pharma have been exiting. In fact, at the moment, only 4 big firms occupy 90% of the market. And developing vaccines for infectious diseases like coronavirus can take several years, because you need to wait potentially months and years to see whether human trials have worked, to make sure there are no dangerous side effects, and to check how long that immunity lasts for, and so on. And so often, by the time you've tested that over several years, the crisis may well have passed, and so with it the demand for that vaccine. And so it's seen as a really costly risk for big pharma. And so public money has been pouring in since the beginning of the year, since the coronavirus has hit, into vaccine development. The UK had announced a 40 million funding injection into COVID-19 vaccines, but on Thursday it announced a further 210 million pounds to go towards a COVID vaccine research, and that's on top of 120 million it's already poured into UK vaccine network. The EU has committed 140 million, the US has committed 700 million. So we're seeing all this public money being poured into the research and development of a COVID-19 vaccine. But what we're really concerned about is that without any conditions attached to all of this massive amounts of funding, there's a real danger that the public end up subsidizing all the risk and leaving big pharma to take all the rewards. So once an effective vaccine has been discovered, the big question will be who will get it first. Now, the two determinants of this will be price and power. Now, with regards to price, as I've already mentioned, if there are no conditions on that funding around access and affordabilities, it will mean that essentially drug companies can charge the highest price that the market can bear, while profiting from public investment. The second danger we've talked about is nationalism and hoarding. Just last weekend, news reports came out about President Trump trying to secure access to a potential COVID-19 vaccine being developed by a German biotech company. Apparently, he had offered large sums of money to obtain exclusive rights to this vaccine for the US only. And this attempt, this sort of shameless America First attempt to get hold of vaccines for America First, I think shows how this industry prioritizes profits, and actually really shows the need for government intervention and global collaboration around fair access to any new COVID-19 vaccine. Because without any intervention, and especially during a pandemic crisis, the first vaccines produced within a country will be prioritized potentially for that country first. But the reality is that production facilities are concentrated in rich countries. So we could be seeing a situation where, once again, it's the rich countries who get access to treatment and to vaccines first, over and above those in the global south. And this is not the first time it's happened. Back in 2009, the initial supplies of the new H1N1 flu vaccine, or the swine flu, were brought up by the richer countries first, which meant that the countries in the global south went without. And it was only much later on that the richer countries, out of the goodness of their own hearts, donated some of these vaccines to the global south. But by then they had learned basically they had already stockpiled all the vaccines and realized they had too much, because actually you only needed 1 dose rather than 2 doses of that vaccine. So they already had double what they needed. And they also, by that time, realized that the virus was becoming more mild. And also that they made sure that they ensured their own populations had enough first before they disposed of any excess vaccines. And so this is the kind of situation we're facing potentially with the coronavirus and with a COVID-19 vaccine as well. So we are Global Justice Now. We are we're still working on our pharmaceuticals campaign, but we are reframing it to ensure that the threats that we've been talking about the last few years around access and affordability are challenged in the current coronavirus pandemic. So we're calling on the government to do a few things. We are asking them to ensure that all public funding that goes towards COVID-19 vaccines treatments have conditions attached to them. And those conditions will be around affordability and access. We're also asking for those conditions to also be around open licensing. So what that means is that even if the treatments and vaccines are patented, that they can be openly licensed to as many manufacturers as possible in order to ensure both the diversity of manufacturers, but also to ensure that the world's production capacity is used at its maximum levels. So in other words, to take away that monopoly part of the use of patents. And we're also asking for something called compulsory licensing. So this is, in the UK, it's called Crown Use, but it's a right of every member state government of the World Trade Organization to be able to use this right to basically override a patent and allow another manufacturer to manufacture a branded medicine or vaccine. And the government has the right to determine the conditions under which to use this right. A lot of countries have been put off from using this because of, especially countries in the global south, where countries like the US have actually bullied and threatened other countries when they do use this right. But it has been used in the last couple of decades over 100 times, mostly for HIV/AIDS drugs. But increasingly, the pressure is on for northern governments to use this right as well. And that's partly driven by the fact that actually high drug prices are affecting all countries of the world now, not just countries in the global south. And then we're also urging the government to take a more active role in global coordination to ensure that there is sufficient capacity for vaccine production and even exploring routes around public capacity. Last year, we did a lot of work around pushing for public ownership of generic manufacturing to enable the state to have a stronger, to have more control over medicines, because we've recognized that medicines are essentially part of the public goods that we want in our socialized healthcare system. And then this week, a really interesting proposal's come up through the government of Costa Rica. The President and Minister of Health of Costa Rica have written to the head of the World Health Organization to call on the WHO to create a global pooling mechanism for rights for the vaccines and treatments of COVID-19, as well as the data and research that goes behind those treatments and vaccines, so that we can ensure there is free access, or at least open licensing of these technologies for all member states of the World Health Organization. So we're calling on the UK government to support that. The World Health Organization has already been, has had a very warm welcome to this proposal, but now we need to get member states to kind of back this proposal as well. And you know, at Global Justice Now, we have long criticized Big Pharma, how it's not fit for purpose, how it doesn't deliver the health innovation that we need at the prices that we can afford. But this pandemic has opened up space for us to push the measures that we've been fighting for a long time. And for the long time, a lot of these proposals have seemed like common sense to us, but they haven't seemed like common sense to Big Pharma and to political leaders. And so we feel there's now space to actually start talking about them, because in the context of a global pandemic, we need these sorts of solutions to ensure that we can all fight this pandemic together. So I really encourage you to join our campaign. We currently have a petition online that you can sign calling on the government to back these asks, the ones I've just shared, around conditions, around open licensing, around creating a global pool of sharing of technology that we can share. So there's a petition online which Sam can maybe post up the link in the chat. And we also have a new briefing that we're launching this morning. Again, this will go into a bit more detail about some of the things that I've discussed. Yeah, so do have a look at those materials as a starting point. So thank you very much.
Great, thanks very much, Heidi. Yeah, you might have seen there in the chat, Sam's posted the direct link to the new briefing that we just put out around COVID-19 and vaccines. There's also a link there to the action that Heidi talked about, and then more widely to the page with all the resources, the previous resources from our pharma campaign that has probably some of the background information there that Heidi mentioned as well, and some other things. So if you're interested in those, go and have a look at that. And great, we've got some thanks coming up in the chat from participants, so that's nice, in the absence of being able to hear any clapping or as you would in a normal public meeting. Yeah, applause, in fact, people are writing applause, brilliant. So what I'm going to do now is then hand over to Nick, who's going to talk about some of the wider economic implications of COVID-19 beyond just the problem of Big Pharma. So, Nick.
Thanks very much. And thanks everyone for joining us today. This was going to be our 50th anniversary event in East London today, which Shalmali was going to come over for and others. And we were going to use that as an opportunity to think about how the values and principles of this organization should be applied to a world which looks, you know, in many ways quite different from the one we were formed in 1970, a world which, as a result of the global economy and the way that it works, has been characterized, especially over the last 10 years, by repeated and ever-deepening crises. None of us, when we were organizing that event, could have imagined quite how deep the crisis would be that we would find ourselves in today. But nonetheless, you know, I think that the principles we've stood for can be applied quite well to the crisis that we're in, and that's what I want to talk about now. You don't need me to tell you how serious this situation is, and I won't. I will say, obviously, I hope that everybody on the call and your friends and family are well and are staying safe, and I know that many of you are involved in community organisation and helping those who are struggling the most, and that's an absolute priority, and thanks and well done for all that you're doing. What I want to do today is focus on how we can make sure, in particular, that our internationalism isn't forgotten in this crisis, when people are understandably very focused on the domestic and even indeed on their local communities. And more broadly, how we can make sure that the cost of this crisis will not be pushed on to the poorest and most vulnerable in our societies and in the world, because we've seen that happen too many times over the past 10, 20, 30 years. And how rather we can use this crisis to fundamentally rethink the way the global economy works. Because if we don't, this is going to be, you know, one of many such crises, more serious even than the one that we find ourselves in today. And there are many arguments I think you can make about why the state of the global economy, the way the global economy works, have fed into creating this crisis in the first place. Industrial agriculture and the way that the big ag works in the world being the most notable of them. I'm not really going to focus so much on that. I don't know if Shalmali is going to come back to some of those questions, but what I really want to look at is the way that the pandemic will be much worse in its effects than it needed to be, precisely because of the nature of the global economy, and particularly because of the absolute obsession with the idea that the free market will save us, the private sector will save us, which has been absolutely hardwired into the global economy that's developed over the last 30 or 40 years. And particularly because the huge inequalities of wealth in the world growing all the time, including, of course, very importantly, between the global north and the global south, this fundamental injustice that, that global justice now was first set up to challenge 50 years ago, how those are going to play into making aspects and elements of this crisis much worse than they needed to be. I think it's already becoming apparent that how well a country is able to contain and mitigate the effects of this crisis are going to depend on how good their health systems and health services are, and also how good a system of public welfare they've got beyond their a health system, how many rights individual workers have in the economy, how easy workers find it to take sick leave, to undertake social distancing measures and so on. These are all going to be absolutely vital in how countries get their heads around this crisis and try to mitigate suffering. And by and large, obviously, it's going to be easier for rich countries to do that. But I also think it's important to say it's not simply about how much wealth countries have got. It's also about, beyond a certain level, it's also about how that wealth is shared within society, how equal countries are. Because if there's one thing that this crisis has made clear, it's that our safety is not simply about how we individually can separate ourselves, can isolate ourselves from this crisis. Of course, there's an element of that, but actually, to some degree, the spread of the virus through our society is about how well protected the most vulnerable and marginalized in our society are. To some degree, we are discovering that we are only as well protected as those at the bottom of our society. So countries with massive inequality, and of course, ultimately a world with massive inequality, are going to be very bad for all of us. I think, you know, anybody looking at what's happening in the United States at the moment, it's really terrifying for me. I think the United States, despite being the richest country in the world, is going to be very badly hit by this crisis. Not only because, in the words of Jeffrey Sachs this week, it's run by a complete nitwit who understands nothing and listens to nothing, but because it also has the most inefficient health system in the entire world, the most expensive health system by far, but one which delivers the worst health results anywhere in the developed world, precisely because it's driven by this obsession with the market. It's preyed upon by big business interests, pharmaceutical companies, but also just more general healthcare companies, giant healthcare corporations that run America's healthcare system. And of course, because workers there have so few rights, are unable to take time off work, have no entitlement to sick leave by law. And because while big corporations and the richest in society are being given extraordinary amounts of public money, the poorest are being told this is the free, you will be taken care of by the free market, or you will not be taken care of at all. So inequality, I think, is going to be absolutely vital, and it's going to give us a new sense of how important equality in society is. But if things are bad in America, I'm very much afraid that things are going to look very, very much worse in parts of the global south. Now, fortunately, to date, the spread of the disease in sub-Saharan Africa is some way behind Europe. It is true, of course, that many parts of sub-Saharan Africa have a different climate from Europe. Who knows what impact that will have on the spread of the disease? And it's also true that the population of sub-Saharan Africa is extremely young. The average age, I just discovered this week, is 19 in sub-Saharan Africa. That may well also have an impact on the spread of the disease there. But take all of that aside, the damage inflicted on those countries over, well, over centuries of empire, but particularly over the last 30 or 40 years, the damage inflicted by the economic policies that have been imposed on those countries by international institutions, by rich countries like our own, they've really been treated like guinea pigs for ultra-free market experiments in how you should run your economy, where a debt crisis in the 70s and early 80s in Africa was used to inflict very, very extreme austerity to force governments to get out of the way of the forces of the international economy across society. You know, they were told, don't try to manage your economy, don't worry about public services, the market will provide, allow the free market to prevail, don't try to have any control over money or trade coming in and out of your economy. These policies have left a very, very deep scar and they're going to make it extremely difficult for countries that adopted these policies, that were forced to adopt these policies when essentially economic decision-making was taken over by Washington, and to some degree continue to adopt them today, albeit the International Monetary Fund and the World Bank have slightly nicer language around it today. They're still being applied to a large extent. It's going to be very, very difficult for these countries to deal with the crisis. And let me just go into a little bit more detail of why. So structural adjustment policies essentially devastated attempts to build up public sector capacity in the 1980s and 90s. It was sort of like a permanent, very extreme, severe form of austerity. And any attempts to build health systems, education systems, social safety nets, I mean, they just couldn't happen. It was extraordinary that in the 1990s, dozens of countries went backwards in terms of their human development indicators. That includes measures of healthcare, measures of education, measures of life expectancy in society. I mean, the kind of things that don't really go backwards unless you have a really awful catastrophe or a war, nonetheless went backwards in dozens of countries in the 90s, precisely because of the economic policies that were imposed on these countries. And where's that left them? Well, you know, look at how many doctors per head of the population we enjoy here in Europe. Here in Britain, we've got 2.8 doctors for every 1,000 people in our society. Actually, that's extremely low by developed world standards. The average across industrialized countries is 3 doctors per 1,000. Germany has 4 doctors per 1,000 head of the population. 45% of all countries in the world have fewer than a quarter of this amount, right? Under 1 doctor per 1,000 people or under. And many countries within that have severely less than that. So Liberia, 200 doctors for 3.5 million people. I mean, an absolutely devastating place to begin to fight an epidemic like this. And indeed, I think, you know, a lot of these countries have never been able to recover from this situation, even when it became clear the scale of the devastation that these policies were inflicting. Because even today, while there's some kind of acceptance, healthcare spending, education spending, these are really important for development, no matter what the ideology of the free market it tells people. Actually, you do need public money to support these things in society. You do need decent, thriving public sectors. Nonetheless, countries are effectively still being prevented from spending what they need to spend on public services. For goodness sake, even here in Europe, when we had the financial crash since 2008, the IMF stepped into Greece and even told Greece to make extreme cuts to its health system. I mean, public health budgets cut by 26%, patients told they had to buy their own medicine if they wanted cancer treatment, malaria reappearing in parts of Greece because they cut back on the anti-malarial spraying programs. This is what's happened in Europe. So in many countries around the world, this medicine is still being doled out in huge measure. 46 low-income countries spend more servicing their public debt every year than they do on public health systems. Much, much more, actually. The average that these countries spend is 8% of their GDP servicing public debt, 2% on public health systems. So massively, massively more, essentially repaying financial markets for money lent to them, often on very unfair terms, way in excess of what they're spending on healthcare. The World Health Organization estimates they should be spending at least 8.6% of their GDP on health systems by 2030 if they want to get up to a reasonable state where they can manage such pandemics. So for many, many countries, essentially this crisis comes on top of a permanent crisis that's been going on for decades now. And it gets worse because the severe austerity and liberalization approach that's has been built on by a whole new wave of development thinking over the last 10, 15 years, particularly pushed by the British government, it must be said, which essentially says, look, you know what, you don't even really need a public sector to provide a good life and a dignified life for people and to fight poverty. There isn't enough money in the public purse. Essentially, you're going to have to rely on private sector flows. You're going to have to rely on the market to do this for you. And so rather than us redistributing wealth on an international scale, essentially what you've had is the use of public money, public funds, including aid money, helping to encourage, to de-risk the situation for the private sector, so private money can flow in and help these countries to develop decent services for their people. And of course, it doesn't work very well, as you would imagine. We've seen that with the private finance initiative here in Britain. We've pushed that same system right the way around the world. I mean, the most scandalous example of it for me is the hospital in Lesotho in southern Africa, where a single hospital was built on a public-private partnership basis, absolutely atrocious terms, where Lesotho ended up spending half of its entire health budget every year, money that was flowing out essentially into the coffers of the private contractors and the financial markets that financed them to build this hospital, half of its health budget. So it's a complete scandal. The British government is still using aid money, especially through the CDC group, to support private hospitals and private healthcare around the world as a solution to health problems. It's an absolute scandal, and this crisis shows that it needs to end right away. What we need to do is try to reverse this trend and help countries build publicly run services, universally accessible services available for all, including the most vulnerable. All the emergency funding promised, and we need massive emergency funding promised from the rich countries to southern countries, especially low income countries, need to be not just about containing the virus, that's vitally important, but about how long term those countries are able to build up public sector healthcare, meaning that they can find it easier to cope when future crises come along. And that means not simply hospitals, doctors, nurses, but as Heidi says, the pharmaceutical research and development, the medicines that we hope are going to alleviate this suffering and bring an end to this crisis. They need to some degree to be publicly controlled as well, in many cases, maybe directly publicly controlled. You know, the way that Heidi describes the Big Pharma system is actually a kind of model for how the whole global economy works. We've got a highly financialized system in which the public sector takes all the risks and capital is allowed to extract greater profits at the expense of the environment from poorer parts of the world and create these vast income streams that flow back into the financial centers and international markets and keep the wealthy wealthy. And here's the second problem you see. You see, healthcare really is just an example, a symbol of the crisis in the global economy. Actually, the idea that the market will solve all of our problems applies not just to how we contain the virus itself, but how we deal with the economic downturn that's going to come as a result of this crisis. And just as many developing countries have been prevented from building up decent public services, they've also been prevented from having really any control over their own economies, any ability to manage their own economies. Again, they were told you just don't need to do that. You know, you leave it to the markets. You don't need to worry about controlling capital. You don't need to worry about building up your own industry or making finance serve a useful purpose. Leave it to the market. And everything will be okay. Well, guess what? We've now come back to a lesson that really we learned at the end of the 19th century, which is that even if you leave it to the market in the best of times, the results are going to be probably massively unequal. But when the shit really hits the fan, when we move into crisis mode, the market collapses completely. It can't be any help to society or to the humanitarian crises that we face in those times. And that's what we're facing now, where even free marketeers in the US and the UK are accepting we need massive wartime-like intervention in the economy. Now, we can do that. America can do that. Most of Europe can do that. But developing countries have been told for years and decades, you can't do that, and haven't been allowed to develop the tools that would enable them to do that. So what they're seeing is capital fleeing back to the financial centers, the safety, export markets, which they've been told to completely rely upon, are collapsing. They can't get hold of dollars to pay for imports, which are essential. They were told this is how you can provide essentials to your people, rely on the international market. That's how stuff will be made cheaper. They can't rely on that anymore. They can't get hold of the dollars to buy those imports. So while rich countries are essentially borrowing for free and have vast amounts of industrial capacity so that they can keep some control over their society, they can keep society running simply by intervening and taking over the economy and running it centrally in a planned way. Developing countries simply can't do that. The market has completely failed them. So what are we going to need to sort this out? A massive package of measures to try to reverse all of this. What sort of things is that going to consist of? First of all, debt cancellation. Debt cancellation is going to be absolutely vital. African leaders have already called for $100 billion of debt cancellation. There was already a debt crisis brewing in many countries in sub-Saharan Africa. If debt continues to accumulate, there's absolutely no way countries are going to be able to do what they need to do. The easiest way of creating spending space, fiscal space, immediately is debt cancellation, immediate moratoriums on debt servicing, and wiping out some of the basis of that debt as well. That cancellation needs to be unconditional. It can't be tied to the same disastrous conditions which have got us into this mess in the first place, these free market conditions, even though the World Bank's saying we need conditions and so on. We cannot allow that. And it must include allowing countries the ability to do things like controlling capital movements in and out of their markets. As capital is starting to flee their countries now, they must have the ability to stop that and to control it. We need huge flows of money flowing into the developing world, not by and large in the form of loans, but there are many other ways you can do it. You can do it relatively cost-free, actually, at least in the short term. You could have a massive expansion of IMF currency. The IMF kind of have this operates kind of like a currency called special drawing rights. You could have a massive expansion of special drawing rights to increase fiscal space for developing countries. We're working with others, like Oxfam, on the idea of a coronavirus wealth tax. Anybody who is profiting from this crisis needs to put that back into an emergency tax, which we can earmark for where it's most needed in the world, a financial transactions tax, et cetera, and really we need to pave the way for the long-term funding of the public services that we create in this moment, so that when this crisis is over, developing countries are not thrown back on the market, that actually they're able to tax the corporations that are coming in and exploiting their resources long-term, so that they can build proper public sector capacity, proper government capacity to deal with these kind of crises. The G20 met in a virtual conference on Thursday. There were some very positive words in what they said, but really nothing like what's needed. I mean, I accept at the moment just getting those people together on a conference call is probably difficult, given the horrific racism and nationalism coming out of some of those world leaders, deeply, deeply unhelpful, toxic. And I know Shalmali is going to say something more about that. There were some positive words in there. There was nothing like the scale of economic mobilization and political mobilization we need to deal with this crisis. I said I thought they were in denial about it. We really need at this time coordination and reform on a level with what we saw after the Second World War, where the Bretton Woods institutions were formed, the markets were massively controlled, and a whole new set of principles were devised as to how the international economy needs to run. I'm just going to finish by saying, okay, is there any hope of any of this stuff happening? We can sit here and say what we think should happen is actually going to happen. Well, I think there are some positives. I think there are a couple of positives. First of all, I mean, even for our own sake, even for a completely selfish free marketeer who wants to get back to business as normal, you cannot allow this virus to just run wild through developing countries. I mean, it's going to come back. We really are all in this together to an extent, and only by safeguarding the weakest and most vulnerable in our society do we have any hope of containing this long term. I think the second bit of hope for me is that the political paradigm has shifted so much in the last couple of months. We see now governments intervening in the economy in ways we haven't seen outside wartime. We will see increasing attempts by governments to limit the role of the market, to bolster non-market parts of the economy, the public sector, and so on. And so I think it's our job as campaigners to say, well, look, you know, if you can do this when it's acutely necessary, you can do it when it's chronically necessary, because it's necessary. It's necessary at this moment to take these measures in order to deal with climate change. It's necessary to take these measures in order to deal with a massively, massively unequal world, which is life and death for very many people, to which the market has no answer. In fact, has fueled many of these problems. So, you know, the tools that are going to be employed in coming days, weeks, and months, I think we are going to be able to point to and to say, you can do it. You've proved you can do it. And now we need to mobilize for a political program which allows us to do it, to tackle the very, very serious problems that humanity faces. I'm not necessarily saying this is how things are going to go, but I think it is the fight that we have to have as people who want to see a different world. It gives us the awfulness of this virus, at least gives us the opportunity to argue that those kind of policies are necessary. And you know, if we don't employ them, this will be the first of many crises, because as awful as this crisis is, what's coming down the road to us, if climate change continues unchecked, is going to be worse. than the toll that this crisis will take on society. So I think we've got our work cut out, but I think beginning to make these arguments at the moment is the only way that we can begin to get some control and some sense and rationality over the global economy that's grown up over the last 40 years. So it's all to play for in that sense. Thank you.
Great, thanks very much, Nick. And in fact, I just want to mention at this moment that we're going to have some more webinars. Basically, we're going to have a little webinar series. Great, you're getting applause as well there, Nick. So we're going to have some a series every couple of weeks for the next little while. So the next one will, we're actually going to shift to Thursdays, I think it is. So the next one will be on the 9th of April in the evening. So we're actually going to focus on some of the things that Nick, for that next one, on some of the things that Nick was talking about there, in terms of the financial aspects of this. So debt cancellation, the idea of a corona wealth tax, and so on. So there's details we're going to have for Tim from Jubilee Debt Campaign, Daniel, who's our campaigner on some of these, on some of the issues to do with that Nick mentioned, to do with the way that the UK International Development Department for International Development is responding, and the World Bank's is responding, and so on, and also Miriam from the Observatory on Multinationals in the Netherlands, who is a financial expert and has been working on this wealth tax idea. So that's yeah, Sam has just posted the details of that in the chat, and you'll find it on the event section of our website. But now, and I've seen the questions, and I'm going to bring some of the questions in little groups once we've heard from Shalmali. But now, without further ado, I'd like to welcome Shalmali, and yes, please.
All right. Thank you. Thank you, James. And thank you very much, Heidi and Nick, for your brilliant presentations. Can you all hear me okay? Yeah? Okay. I am going to read from my computer. So if because I don't have a printer, I have no way for me to print out what I wanted to say. So if I look a bit unfocused, my apologies. And James, in case my internet connection or something goes, just, I don't know, holler, make some noise, whatever. Okay, thank you. All right, so hello everyone. I'm joining you from my home in semi-rural area in southern India. And India is under complete lockdown till 15th April. And we really have no clarity what will happen after that. The rumors are that the lockdown will continue, but the lockdown is already having quite disastrous impacts, which I'll get to in a bit. I was going to talk a bit about structural adjustment and other issues, but Nick's already talked about them, so I don't need to go there. But let me start by quoting Larry Brilliant, Dr. Larry Brilliant. He's a very well-known epidemiologist who helped to eradicate smallpox. And he said in a BBC program several years ago that outbreaks are inevitable, pandemics are optional. And this was quoted again recently by Sonia Shah, a science journalist, in an article in The Nation in February, where she basically pointed to the complex impacts of the human imprint, of the human footprint on ecologies and habitats, on urban expansion, the footprint of industrial agriculture, indiscriminate industrial activity, environmental pollution, and so on, in creating the conditions for pandemics to occur and flourish. And I will bring this up again. Nick has referred to them very well when he talked about structural adjustment, which is one of it was sort of setting, it's almost like chronicles of disasters foretold. And Heidi talked tremendously about the importance of having been prepared beforehand, which we weren't, because markets took precedence over people's health and people's rights. So we have actually created, in our generation, humanity created the conditions for pandemics to occur not just once, but repeatedly. Now, the remarks I want to share with you are based on information, from sources that I trust, from my own colleagues in Focus, what I'm seeing, who are people who we are working with, and of course, analysts we work with. Now, the COVID-19 pandemic is, I think, truly novel, not only because of the novel coronavirus, but equally more so, in fact, because of the context in which this pandemic is manifesting. We live in this extremely globalized world where national economies and much of the world population's welfare depends on global supply chains that span the entire world, which in turn, of course, requires international travel and mobility, allowing the virus to spread exponentially. But fighting the virus and getting the materials to fight the pandemic also requires, unfortunately, that level of tapping into global supply chains, because countries have externalized very important functions and aspects of protecting the public interest. Now, the virus does not discriminate who it infects by class, race, gender, ethnicity. But the way things are now, class, social privilege, race, and ethnicity are important in determining who are most exposed and vulnerable to the virus, who experience the very worst impacts of the pandemic. And the worst impacts of the pandemic are not only infection, which of course is very important, but also the economic, social, and health impacts of the measures that the governments are taking. For example, lockdowns and curfews and so on. And I'll give you some examples of what's happening in Thailand and India and the Philippines and Cambodia. Now, this is true in Asia, but I think you'll also see this is happening among the working class and migrant populations in the north, who are facing a brunt of lockdowns and curfews, which the middle classes and privileged classes in the north are not facing. Another very important aspect of the present context, of course, is this huge entrenched inequality within and across the countries, and Nick's already talked about them. Everybody's read the statistics. I'm sure all of you are very well versed with what's happening in terms of inequality. But what that means in practice, what does inequality mean in practice, is horrifyingly visible when we are hit by a crisis like COVID-19. Now, because of structural adjustment programs, because of neoliberalism over the past 4 decades, and this unbundling of manufacturing, food production, and services into global value and supply chains, workers, peasants, artisanal fishers, herders, people in low-income brackets have become what we call the precariat. Much of what we consume in our daily lives comes from the precariat. Millions of people across the world are migrant workers in agriculture, in factories, in the hospitality industry, in construction industry, in domestic work, in public works that are essential to maintaining public hygiene. And, so for example, public health depends not just on health services, but a number of other services, and I'll come to those. Now, these workers, whether they're in the construction or agriculture or whatever industry they are in, and peasants, they're poorly paid. They have little or no access to basic services and adequate food. They live in very cramped homes, slums, and shanties. Now, how can they practice social and physical distancing? How can they wash their hands several times a day when they don't have water? How can they not touch their face when they have no fans, when it's hot? They have no way of cleaning themselves. How can they wear masks? How can they follow the protocols that many health services have mandated? How is that even possible? Many workers are daily wage earners. They and their families eat if they earn that day. With the lockdowns that we have in many countries in Asia, how will people eat? Without adequate nutritious food, how will people build immunity to fight a virus or to fight any virus? Now in India today, we have 4 billion people. They're out in the open. They have no shelter, they have no food, they have no healthcare. Most of them are workers who are migrants from rural areas who have come to our massive teeming cities, to work in the construction industry, for the wealthy, to build our houses, or they work in other service sectors, they clean the streets, they work as domestics. Many are seasonal labor, and they're all stranded, and there is no protection for them. Now, Nick already talked about how structural adjustment programs and neoliberalism has resulted in the gutting of public health systems, but also public services and goods in the South, of course, in the North as well. So hospitals have been privatized and governments have disinvested from public hospitals and health services. So they basically, with privatization, governments pulled back across Asia. India didn't have, for example, but particularly robust health system, but whatever it did have, whatever the people depended on, has also become much more precarious because the government over the last 2-3 decades has been disinvesting from any public services and public health systems. So as a result, not only low income, but even middle income and relatively wealthy countries, we just don't have, we across the world do not have the infrastructure to deal with a pandemic of these proportions. This includes trained medical staff, life-saving equipment, beds, hospital beds, testing facilities, systems for triage, research, monitoring, medicines, even masks and gloves. Now, this weak infrastructure, health infrastructure, is exacerbating respiratory and other virus-related health problems that among populations who have been exposed over long periods of time to environmental pollutions, toxins, and unsafe work conditions. I don't know, I'm sure all of you may have read over the last couple of years about the terrible air in Bangkok, in New Delhi, in Mumbai, in Bangalore, in Manila. Air quality index is so bad that people have developed chronic pulmonary respiratory lung conditions. The people, again, who are the worst affected, of course, are agricultural workers, workers in chemical plants, extractive industry, those who clean the sewages and other public areas. And basically, low-income communities and populations who live in the extremely polluted metropolises of across Asia. Asia is supposed to be the engine of growth for the world. It was supposed to pull the world out of recession after the 2008, 2009 economic crisis. And this engine of growth has come at a very, very high chronic health and safety cost for majority of the people there. So this again goes back to the point that Larry Brilliant said, that pandemics are optional. It didn't have to be this way, but it is this way now. Now let's look at the responses of governments. Yes, this is a massive pandemic, etc. I mean, I'm not a scientist, I'm not a doctor, so I'm not pretending that I know how to address the pandemic. But we do need to look at responses in terms of effectiveness, equality, justice, and human rights. Public health is related to many more factors than medical facilities. It's related to services, goods, rights, and justice. And here again, we see inequalities of impacts, because we've seen time and time again in India, in the Philippines, in Thailand, in Cambodia, in Myanmar, across Asia, in Bangladesh, in Pakistan, the natural calamities and pandemics hit the poorest and marginalized sectors the hardest. And it is these communities that are often ignored, discriminated against, and marginalized even further through government responses. I mean, basically, COVID-19 has exposed all the weaknesses of the public health system across the board. Our crowded and ill-equipped hospitals just can't accommodate the needs, especially of the poor during the health crisis. In Thailand, the government has actually been able to maintain a dual system. They maintained a very strong public health system as well as private hospitals, but even they are struggling. And if we look at India, for example, healthcare has been privatized since the 1990s, and the Indian government started disinvesting in healthcare about 20 years ago. Now, public government hospitals lost the financing they needed for equipment, training, materials, competitive salaries, other facilities. Even committed doctors and personnel eventually left because they just weren't being paid. All small towns and cities we've had a sort of a mixed system. We have general practitioners, who you go to them for your small ailments, and then they refer you to other bigger facilities for tests or specialized treatments. And of course, those who can afford it all have been going to private hospitals, which are very expensive. Insurance, there's a big insurance industry in India, but it's not health insurance, medical insurance. It's for hospital costs and it doesn't even cover medicines. But now with COVID, what's happened is that government hospitals have become the first centers of call. And so it is these government hospitals, it's these facilities that have been disinvested in for the last 20 years that are these are the baskets where where all the sick people are going. People are panicking, and that's where they're going. And we have news reports of doctors in municipal hospitals working shifts of 15 to 18 hours without sufficient protection. The numbers of patients can vary from 300 to 500 to even 1,000 a day, and they're handled by just a few doctors. So, but now there are private hospitals. They could be called into service, but they're not being called into service. And when people ask why, basically the point is that across Asia, what we're seeing, especially in India, Philippines, and Cambodia, that apart from lockdowns and curfews and closing borders, the strategy that the government has to address this pandemic, the strategy is simply just not clear. What we're seeing again and again in the times of crisis, how the rich and powerful flaunt privilege, the top political leaders in all the countries where we have programs, it's India, Philippines, Cambodia, Thailand, Myanmar, Laos. The rich and powerful and the political leadership all have direct and easy access to testing and treatment. But the state continues to deny mass testing because they say they don't have the kits. They can't even do triage. If you get sick, stay at home. But if you don't have a home, if you are stuck in a shanty town, if you are walking to your village, which is a 2-day walk, where will you stay? So many of our colleagues and many of the social movements that we're working with are talking about how we're back to the socialism for the rich and very brutal capitalism for the poor. Now, when we look at the impacts of the crisis and the lockdown as a response to the COVID crisis, the crisis, when the government in India a few days ago, with 4 hours of notice, announced a 21-day lockdown and said everybody off the streets, nobody gets anything, nobody steps out. One of the biggest issues that came up was that people are going to die of hunger before they're going to die of corona. And the virus is a flu virus. Young people, healthy people can survive it. People don't have to die of it, But of course, it needs to be checked. So the lockdowns and maintaining distance and doing everything that is possible to prevent the spread is important. But there also need to be measures in place that support those who are not able to survive these lockdowns, especially migrant workers, daily wage earners, people in the informal sector, indigenous peoples outside, rural peasants and fishers, and so on. We look at food supplies. In the Philippines, for example, there is a group called Lilac, which is a solidarity group that works with indigenous women. They have been monitoring and working on the impacts of COVID-19 with indigenous people in the different areas across the Philippines. And the communities are pointing out that even before this health crisis came about, communities were already suffering, especially indigenous women and their families, because farmers and vegetable growers have been carrying the heaviest burdens of climate change and of all the extreme weather. They've had ruined harvests, they've had no water, their foods and income sources have been devastated. Many indigenous communities in the Philippines, but also in Cambodia, also in Thailand, also in India, also in Bangladesh, are victims of land grabbing by corporations and by governments to make way for large infrastructure, for mining, for industrialized plantations, and for projects that basically treat natural resources as profitable commodities. When people protest, our areas get militarized. Militarization is rampant in all communities that are resisting this kind of industrialized development and so on. And so people leave their homes. People leave, indigenous people, but also other rural communities leave their ancestral homes. Either they have to leave or they end up being shot or killed by the military. They become migrant populations. And these are the people who come to our cities and our towns. These are the people who work as seasonal agricultural labor, whether it's in Thailand or in Myanmar or in Laos or in Cambodia and in India. And what we're seeing now is that the responses by the governments are not providing succor or support to them. They are bailing large agribusiness, they're bailing out construction companies, they're bailing out finance capital. Oh, it says sorry, I just got a message saying that my internet connection wasn't stable, but I guess it must be okay now. There have been no congressional or parliamentary oversight on coronavirus emergency funding legislation. It's completely skewed towards corporate bailout packages, not providing any economic relief for the poorest of the poor or for daily wage workers. The economic stimulus packages do not actually say how the millions of people who are out of work and who are now sitting out in the sun and at night have no shelter, how they're going to be provided for. Frontline workers are risking their lives to provide healthcare, food, and other essential work, and they're taking the hardest hits. There's no equipment. There's no plan for them. You know, the economic stimulus is saying, okay, we have to pull the world out of recession after COVID. But what happens now? In India, food that's grown by farmers, fish that's caused by fishers, it's rotting because the government has not made any provisions to collect this food and get it to markets and distribute it. We have food in India. We don't need to have hunger. We have food, but it needs to get to markets. It needs to be distributed. For that, the government needs to step up and provide safe conditions to get this food to markets, to get it to the people who need it most. They need to provide safe trucking facilities, storage, wages for transportation, adequate prices for producers, but they're not doing this. Instead, they ordered a 21-day lockdown and a 4-hour notice with no support to hundreds of thousands of rural poor and the wage earners and migrant workers. And people have been walking for days just to get to their villages because there are no buses, or they're risking transportation in cramped containers to get out of cities. And now, to talk about physical distancing, social distancing, you know, draw a circle around you, look after yourself. How are people going to do this? So, I mean, this brings me back again to the earlier point I was making, that public health is dependent not just on medical facilities. It depends tremendously, you know, on the kinds of conditions that we create, on the kinds of social conditions that we have, on the issue of social justice, access to other public services, and so on. Even curfew rules and punishments for those that violate quarantine, even those are being applied differently. There are those from the poor communities. If they're caught, they're beaten up in India or in the Philippines. They're put in cages. They're put in jails where they're crammed along with others. But, you know, politicians and rich people who violate quarantine, they get away with it. In fact, they're the ones who are spreading the virus even more often, more widely. But because there's no testing, you know, that we're aware of, through which we can know, we're not getting the information about who, you know, how the virus is being spread, who's, you know, and how much you know, we're not getting a proper map of zones of, for example, in any given area, populations, some could be more severely affected, some could be less severely affected. We have no information because governments are simply not sharing that information. They don't have that information, and they don't want to say that they have that information, because that means that they have to they have to turn the lens towards what they're not actually doing. The examples, I mean, migrant workers are really suffering in a way that is unimaginable. It's horrific, really. If we look at what's happened in Thailand, for example, or the areas in the Mekong region, more than 60,000 migrants are stuck at closed borders. There are approximately 3 million migrants who have been from Myanmar, Cambodia, Laos, and Vietnam, who've been rushing back. They had to go back to their homes because there's no way they could stay in Thailand. But they have, many of them, the borders have closed. They have no way to go back. Workplaces have closed. They have no way to eat. They have no health care. They have no place to stay. They have no relief measures from their employers. and there's no clear communication about an emergency plan or relief measures from the governments. They also face negative impacts from very restrictive measures because many of them are undocumented. They don't have papers, so they face arrests and being locked up in places, where they're crammed together. They're not able to access key messages and updated announcements because they don't speak the local languages necessarily. None of the hotlines or information that's supposed to go out to them reaches them. They're particularly also vulnerable because they are immediately identified as the outsiders, as the problem, as the people who create the problems. They're facing tremendous amounts of racism and prejudice. And when we're talking of migrants, we also need to look at what's happening to people who are fleeing from conflicts, wars, and who are under occupation. Coming back to India there, I bring up the point, the example of Kashmir. Many of you have heard about what's happened in the northernmost state of Kashmir, which has been under the most brutal lockdown since last August. And it's already a state where social, medical, other economic services have been devastated. But increasingly now, they don't even have access to proper communication. Internet access, for example, has been even recognized by the Human Rights Council and even by the Indian Constitution as a basic right, because so much communication, so much information comes through internet. Doctors can't get information about the latest protocols. They can't get testing. They can't get cases. They can't communicate out of the state. So the political situation and a pre-created lockdown situation in Kashmir, condition of occupation, a condition of war and conflict, has exacerbated and made the population of Kashmir. They made them sitting ducks. Related to that, what we're seeing is a cementing of authoritarianism in India, in Thailand, in Cambodia, in the Philippines, in Myanmar. Basically, Congresses and parliaments have approved draconian measures. Emergency measures have been approved by governments. Colonial era pandemic laws have been reinforced. Emergency powers have been re-granted to governments without any oversight from any democratic bodies. And of course, in times of crisis, we know that human rights are the first systemic casualty, because we hear government officials saying all the time that human rights must be suspended during a state of emergency, you need a heavy hand, people don't listen, and so on. And the thing is, people are so panicked that they're willing to let this go. They're willing to say, okay, we must listen to the government, we must listen to the government. We're willing to have the military in our streets, we're willing to have the police in our streets. But the reality is that governments don't have clear plans for combating the pandemic, for building trust with the public, and to win compliance for these severe measures and ensuring that those who are economically and socially vulnerable are actually looked after. They're not sharing full information about the natural situation because they don't have it and they don't want to admit they don't know. So instead, what they're using is defamation laws. They've added into the laws across Asia that anybody who criticizes what's happening, what the government measures are doing, can be arrested for spreading fake news, being anti-national, and so on. Now, this is the situation, but there are many proposals by movements, and I think I've crossed my 15, 20 minutes, so maybe, I don't know if I still have time for that, or shall I wait for questions? I'll do whatever you say, James. I'm sorry.
Yeah, well, maybe we can come, you can come back to it, because I think, there might be some questions relating to it as well. So
right.
Just because I want to make sure that we do get some of the questions
right.
in and what
sure.
have you before we have to finish.
Right.
But thank you very much. I think that was a really interesting insight into the way that this is playing out in Asia, particularly. And also, I think that question of the authoritarianism, and I mean, I think we've seen even a little bit of that in the UK in terms of some of the quite draconian things that have ended up being passed in the bill that was passed before Parliament was closed early on Thursday. you know, we can see that there's a danger there. You know, we want a progressive outcome, and people are starting to ask questions about, well, what's, you know, what the problems of relying on the market and so on. But also authoritarians are also looking at this, and you know, there's a danger we can go in that direction as well. So, but I think we'll come back to that. I wanted to.
We have already gone in that direction. In Asia, we've gone in that direction.
Right. Yeah. Yeah. So, yeah. I mean, obviously, this is a trend all across the world, right? With the populist authoritarians. So, where, you know, there's a question. Maybe some of the other speakers want to sort of comment as well, as we go through some of the questions on how that plays out, that dynamic of what this does for all the hard right populists and so on that have been elected around the world. But I just wanted, before we do that, I wanted to come back to start off with, because there's some questions that were put up earlier on, some sort of, I guess, clarifying questions about pharma, and some of the stuff that Heidi was talking about. If I can just find them. So I think there was definitely, I think so one of the questions is why aren't patents assigned to the public funding, if you like, rather than big pharma? Like, why does big pharma get these patents, basically? I mean, I think there's a clarifying thing there. And then also a sort of another related question about pharma is, isn't there a risk that the NHS will be beholden to big pharma and extortionate profits as part of the post-Brexit trade deals? So that's maybe something you could sort of develop there a little bit, Heidi. And there was a couple of questions. One of the questions said, obviously Global Justice Now has been campaigning on pharma for years, but isn't there a risk we'll be seen as kind of riding on the crisis? Although then another question almost seemed to be asking, how do we ride on the crisis to get our point across? So I don't know, maybe you want to address those two contrasting perspectives. But
cool. All right, so just go for all three of them in the same go, yeah? Okay, cool. So in terms of why do big pharma get patents or patents, I don't know which way you pronounce it. So essentially, certainly the UK government, and actually most governments in the world, don't have the ability to actually develop and then manufacture and distribute medicines. So that's why you have a situation where you're seeing an increasingly split between the private sector taking on the latter stages of the drug development process and the public sector taking on the earlier parts of the process. I mean, I believe there's sort of state manufacturing in Cuba, but there aren't that many more examples of them across the world. I think there might be something in Sweden, and I think the Chinese government also have some capability, but in terms of government capability to do that, so that's why, in a sense, when the public researchers do kind of come up with a breakthrough discovery, they're then kind of beholden to big pharma to then take that on and get that into market. And so actually, we've been talking about these issues for the last 3 years about the role of big pharma in R&D, and actually, whenever I speak about this, the first question I always get actually is, why don't we have publicly owned manufacturing capability? So actually, what could happen potentially in this model is the public sector fund the research, which they're doing already, because this is the bit that big pharma don't like, and then at the point of discovery, the public sector, the publicly owned pharmaceutical company could then take on the development and the manufacturing and the distribution of that medicine. So that's something that we've been pushing for, certainly as Global Justice Now, and actually it managed to get into the Labour Party manifesto just before the general election, and Jeremy Corbyn talked a bit about it before Christmas. And so that's the kind of rationale for that kind of approach. And with a pandemic that we're facing right now, that issue I think is going to come to the fore once again, because the world doesn't have sufficient production capability to produce the volume of vaccines we're going to need once a vaccine is discovered. But we've also talked about models where we could actually, so at the moment we're paying really high prices to get access to that innovation. Actually, there's an argument to say, could we actually pay for that innovation up front? And we issue things like prize funds and grants to enable developers to come up with that medicine. And so we disconnect the kind of the price of the medicine or the drug to the actual input costs. And something like that is where you can then control. Well, then what you would do is you develop do the research and development, and then you could then, like I was saying earlier, openly license it to different manufacturers. So that's also another approach. In terms of the NHS being beholden to Big Pharma post-Brexit trade deals, yeah, this is completely a real threat to post-Brexit trade deals, and especially with a US-UK trade deal. Because Big Pharma are very powerful in the US, probably, they're one of the most powerful. I think I think the US pharma lobby are the highest spenders in terms of lobby spend in the US. So they're very powerful in the US system, and so they have been chomping at the bit for years to hold their hands on the NHS market for drugs, because we are a single purchaser of drugs, we buy in high volumes, and so it's a very attractive market. And they've long moaned and complained about how they can't get good enough prices in the UK like they can in the US. So in the UK, we're still paying very high prices, but we have more regulatory systems to control that price. So we have NICE, for example. We also have a few voluntary schemes that Big Pharma sign up to. We also can negotiate bulk discounts because we are a single purchaser. So all those things don't exist in the US. There's absolutely no regulatory control around prices in the US. It's a pretty much wild west of pharma prices. So yeah, so there's a real danger that Big Pharma will get what it wants through a US-UK trade deal, which is why one of our other campaigns that we're working on is to challenge and oppose the US-UK trade deal, because it poses a big threat to our drug prices and even to our NHS. Third question about riding on crisis, not riding on crisis. I think that actually, this access to medicines movement, this global movement, has been around, for the last 20-30 years. Certainly, it first kind of sprung into action around the HIV/AIDS epidemic of the 1980s, 1990s. So actually, this has been like I said, a long-standing movement, and it's kind of, and every kind of major epidemic, it's kind of sprung back into action again, saying the same thing again and again. So on one hand, I feel like, yeah, we are kind of riding on the crisis, but at the same time, we've also been working on it for many years. And actually, I feel like I was saying before that I feel that this is a real opportunity to really demonstrate how flawed the model of pharmaceutical R&D and production that we have. Like, we've been saying it for many years, but actually, I feel like suddenly now, everything that we've been saying has much more prominence and much more immediacy and much more urgency around it. So I feel like we do have to use this opportunity to really highlight how broken the pharmaceutical model is, and what the real steps that we can take, that governments can take right now to address the pandemic.
Great, thanks, Heidi. There was also a specific. There was a few questions, and I saw stuff in the chat as well. People seem to sort of welcome the idea of a coronavirus wealth tax, Nick. And some people are saying, what can we see some more details of that? How are you working with Oxfam? Shouldn't we all be, working together? And so I mean, maybe you could say something more about that, Nick.
Well, to be honest, it was an idea that came from Miriam, who works for SOMO, who's going to be speaking at our first webinar that Sam put on the chat there. And she proposed it along with a whole range of other measures to a list that a lot of policy people are on, who think about these things, only a few days ago, and it was the thing that a lot of people jumped on, including us and Oxfam, and I think Assad at War on Want was interested. A few of us were interested in this and developing it. So we've really just been, I mean, absolutely, she's kind of done a very draft proposal, which we're all working on to try and make into something which makes sense to people. Think about the framing. How could we inject this into the political debate, and what would it look like, and how would it work? And so it's just very early. This has literally been a few days we've been thinking about this, and yes, we will absolutely try and get it out as fast as we can, and absolutely when we do that, we are up for any comments and suggestions. And I mean, look, one of my first things I ever campaigned on was the Tobin tax many years ago. And, you know, that was something we put out there as an idea, and it was then refined and built on, and lots of policy experts got involved. And so I think, you know, there are lots of different ways you can do this. I would definitely like to get the basic idea out there as soon as possible. That could be just in a few days. And then we spend some time refining it and taking inputs into it, and then beginning to campaign on it. But yeah, it's not something we're sitting on unnecessarily. It's just something where there's so many ideas at the moment, and we're just thinking which are the most useful for us to put campaign energy and mobilization into, because we might be able to achieve them. And I think debt cancellation has gone very high up to the top of the list, just because a lot of people already understand it because of the campaigns that we've done in the past, because we know it's a way that you can release fiscal space, that you can release spending space in developing countries very quickly. So it would be hopefully effective. So we've pushed quite a lot towards that, and then we're thinking what the next more structural follow-ups will be. And I think a wealth tax, absolutely. But yeah, we'll get it to you as soon as we possibly can.
And I can see, so Mary in the questions has asked that about, you know, right wingers will use the current level of public expenditure that we're now seeing and the whole of production to claim the need for lots more austerity afterwards. Or I mean, I guess that's a question, will they? But presumably, certainly some of them will. So how do we actually sort of change that argument? How do we persuade the public? How do we win the argument that austerity was the wrong answer after 2008 and it's the wrong answer now? Because there is a sense in which suddenly constraints on spending are out of the window because of the crisis. But surely at some point people are going to come back and say, we've spent all this money now, there's no money left. You know, so maybe that relates to the wealth tax, but it also, like, it's also about a wider narrative. So, I mean, perhaps any of you might want to comment on something like that. Oh, you're...
Yeah, do you want to go first, Shalmali?
Yeah, if somebody else wants to go first, they can, or I could say a few things.
Yeah, go.
All right. Well, I think, okay. I think we need to work on solutions that are systemic at multiple levels, you know. So internationally, okay, we talk about solidarity. What does solidarity actually mean in practice? How do we realize solidarity? You know, what does it really mean? So on one hand, it is Cuba sending doctors to Cuba, sending doctors to Italy, China sending supplies to Iran, and so on. So, you know, so they're trying to get rid of the embargo on Venezuela so that countries can get the financing that they need and the technical support and the access to medicines and so on that they need. There's that level of systemic work at the international level, I think, that needs to work. Nick's already talked about debt cancellation. It's really important, but I think one caveat I would, not caveat, add in addition to that, I'd say is that we have to be really careful of what the World Bank and the IMF come up with in terms of their structural reforms, because their priority seems to continue to be to pull the world out of recession. So their appeal to the G20 for debt cancellation was not so much cancellation or repudiation as it was a delay in payments. And that they would then assess and give report cards to governments on, you know, what for next future structural reforms need to be taken and so on. That's one thing. Okay, another issue is on the issue of austerity. Yes, it's true that we are in that process now, but I think one of the things that we need to do nationally, and I think in the South, in Asia, we can do it, and we have to do it, is to point out what disinvestment in public services did, what privatization did, and fight the corporate bailouts. Because there is money. That money isn't going to the public. So even now, in the middle of a crisis, I mean, there is no reason, for example, for a country like India to have to be going through such a crisis. I mean, at this scale, yes, there was a lack of preparedness, but, you know, we have the manufacturing capacity, we have the medical personnel, we have the research facilities, there is the capital, lots of really rich industrialists in India, I know, seriously. Same in Thailand, same in the Philippines. The money is there. The brains are there. The manufacturing capacity is there. Why isn't it happening? Why is the money going? Why are we going back to business as usual and bailing the corporations out? And I think this has to be a very, very important aspect of any campaigning we do. And there's nothing good at all about this pandemic. The only hope that many of us have is that this can at least bring people out of the woodwork, and so that we can, you know, we can show how our abilities societally, nationally, were already crippled to deal with these crises before the virus even showed up. And I think for that, we need to do a lot of national work, because one of the things that the right-wing governments are doing is that they rode to power. They were democratically elected, and they claimed democratic mandate for narrow versions of nationalism by using the argument that globalization didn't work. And now they continue to use that same narrow nationalism to say, see, it's the outsiders who are bringing in the virus. However, they continue to support corporations. They continue to support the wealthy elites who are all financialized. They all depend on transnational finance capital. All of us, Global Justice Now, Focus, all of you people on the chat, everybody, we all have a critique of economic globalization and corporate globalization. We're not those types of globalizers. We're not corporate globalizers. But the way the right wing has used that narrative is really dangerous. And now they are continuing to use that narrative to hide the fact that they do not have a strategy. I mean, what Heidi said about, was pointing out about pharma, it just exemplifies that so well. I mean, if you look at what the United States do. So nationally, there are a number of initiatives that have been proposed by people's movements, by the People's Health Movement, by trade unions, by working class unions, by migrants groups, etc. So maybe what I'll do is I'll just write up my presentation and put some links, and I'll send them to you. So, because there's so many proposals that are coming out. But really, I mean, I request all the viewers to please look at the People's Health Movement and the different trade union websites. You know, well, there are lots, and I'll share those links with you.
Great, thanks, Shalmali. Did either of you two want to comment any more on the?
Well, I mean, only to say, I think that all sorts of people are going to be calling for things that you never expected them to call for, and that provides us with an opportunity. I mean, in the last week, Ecuador, Chile, Costa Rica have all said that they will use compulsory license if they have to get around intellectual property of big pharma companies and produce medicines themselves. I was literally just before the call started reading today's Financial Times editorial, which says, absolutely, of course you should use compulsory licenses if you need to. So extraordinary, right? I mean, we didn't get those kind of recommendations in the mid-90s in the HIV epidemic. So things have moved on, things have changed, and people are, I mean, you know, yesterday, Trump, he's been desperate to not use this Defense Procurement Act to force manufacturers to make ventilators and stuff that hospitals need. He really doesn't want to do it. Yesterday, he did it because he had to. He had no choice. And I mean, he's somebody who barely even believes this is real. So, you know, you are going to see governments taking very extreme and strange measures that they don't want to take because they simply have to keep the economy going. And I think from there, it's for us to begin to change the culture around those kind of steps and to say they don't have to be just emergency steps in the way that, you know, our forebears did in the Second World War. I mean, when the Second World War, of course, in the Second World War, there was extreme intervention in the economy. There was control of the economy in a top-down way by governments because we had to. After the Second World War ended, of course, there were people on the right of the political spectrum who were saying, rescind these this way of operating. We need to pay back the debt. You know, the debt was much higher then than it is now. But actually, that didn't win out in the population as a whole. I mean, people saw the way that it had been used and say, if we can do some of these things in wartime, why can't we do them in peacetime? And that's where our National Health Service emerged from. That's where our social safety net emerged from. So there's no guarantee of which way this is going to go. And I mean, I completely agree. It's frightening. It's frightening, and I can't. I absolutely can't tell anybody it's likely to go in this direction or it's likely to go in that direction. But I guess that's our role, right? I mean, that's our role, is to push it in the direction, is to convince people that if you can do this in an emergency, you can do this in order to tackle climate change. You can do this in order to tackle inequality. And if enough people agree with us, we will move in that direction. So yeah, for me, it's why campaigning is important. I mean, it's not to take away from all the amazing and immediate necessities that people are organizing in their community to help people. That's also really, really essential. But to lay some of this campaign work on top of that is really important if we want to change society in a way that this crisis has shown we need to.
I don't know whether do you want to say something on that, Heidi? Or?
Yeah, just very quickly. Yeah, no, I just wanted to, in campaigning, when you do campaign training, one of the sort of ideas that we talk about often is a battle of the story. It's about who wins the narrative, and whoever wins the narrative gets to win social change. And I feel like we've got a real window of opportunity to win that battle, of the story, to actually to put that narrative out there that actually, very similar to what Shalmali was saying about, the austerity created the conditions for this pandemic to flourish, that this pandemic was an optional thing. It didn't have to happen. So actually, I think it's those kinds of stories that we need to continue to tell. And then throughout the pandemic, we say, actually, the solutions to the pandemic are all about, making sure that it's not the free markets that are left to free reign, but actually we do need intervention to make sure that we have equitable solutions for all the things that we're facing at the moment. And I'm hoping that things like, for example, even the other night on Thursday night, I don't know how many of you kind of took part in the big clap for the NHS staff and social care workers. I feel like even that, just seeing people's responses on their social media, and their sense that actually we really do see the importance of public services, the importance of the NHS, but also the importance of all the people that are keeping our economy running at the moment, all the people that a few months ago the government said were low skilled and we didn't value them and we don't want them in this country. Actually it is the truck drivers, the delivery people, the care workers, all the cleaners. Those are the people that are keeping our economy running. And I'm really hoping that, like Nick was saying, that there is a cultural shift as to how we see and how we view public services during this time. And I do think that actually when we come out of this pandemic situation, that actually the next crisis we're going to have to face is the climate crisis. And actually talking a lot about the Green New Deal and how actually we, instead of reverting back to an austerity mindset, we actually need to continue to invest, and we need to continue to use strategies that kind of deal with public services, jobs, the economy, and the climate crisis all in one go. So I think that this is an opportunity to kind of try and shape that narrative now.
Great. Just coming out of that though, I just want to go back to a question that I think, was it Julia asked earlier, which was, so of course we can help fund Global Justice Now staff to raise these kinds of issues, and absolutely you can, but also she's saying, but what else can we do as individuals at a local level? What can we actually do? And I mean, I guess it's about having that argument, of course, but like, are there any more concrete suggestions than that? What can people do at a local level, especially when local groups can't meet physically at the moment, and so on, local Global Justice Now groups and so on. So have you got any immediate responses to that?
Well, I think we're trying to make the campaigns as virtual as we can at the moment. So there's actions that we've already put out there on the Big Pharma campaign. And I would say it's not just us, of course, there's a range of organizations doing the same thing. And I would say that is having an effect. That's definitely having an effect already. It's already shifted attitudes. I mean, the idea that Heidi talked about, that Gilead, the Big Pharma company, asked for this absolutely outrageous status, for this orphan drug status that would have given extra payments, had to withdraw it in a few days. I mean, that's public outcry. That's campaigning beginning to work. I don't believe that FT editorial would have included that line about compulsory licenses if people weren't talking about this and pushing for it. So, don't underestimate. I know sometimes it feels like, you know, what we're doing isn't really commensurate with the task at hand and the change, but don't underestimate it. And as the days and weeks go by, we're going to try to push that kind of campaign potential and mobilization into some of the other areas we've talked about today as well, like debt cancellation and wealth tax and so on. So we'll have a number of things. Now, I completely get that it's really hard at the moment for how you talk about this in a local community, because we're all in our houses and whatever. We're trying to find ways to make online work more effectively. Sam's series that he talked about that we're doing hopefully will allow us to spread information and allow discussions, and hopefully on those slightly smaller discussions there'll be a bit more time for participation and there'll be less people in the virtual room and so on. So we're trying to do that. We're going to do some podcasts and I think a lot of what we can do is use this to share. I mean, we're still talking to people, right? We're just talking to people in a different way. I in an evening will occasionally have a Zoom call to have my beer in a pub with other people all in their own living rooms. We're still talking, we're still having conversations, and that's the bulk of what campaigning is. It's about convincing people. It's about, first of all, convincing our friends and family and people near to us, getting these conversations generated, getting them to take actions and so on. I also think, don't underestimate the campaign. I don't want to make this look cynical. People are involved in mutual aid groups and volunteering for the NHS and all the rest of it because they desperately want to help people, and that's right and good and proper. But as the crisis goes on, as things continue, that will give us also the opportunity to spread new ideas amongst people that are being helped, that we're working with, that, you know, we've got to do it carefully and in a socially distancing way. But it will give us the opportunity to also say, okay, and also these networks that have sprung up, they've sprung up in lieu of the state taking proper measures, the state being able to have the public services at a level of preparedness that they can deal with this. What we need to do next when we come out of this is begin pushing. And we may find we've got new networks, we'll find we've got new activists, we'll find we've got new campaigners who are inspired by some of the actions that people on this list, I'm absolutely sure, have taken, and will want to join with us in campaigning for that kind of structural reform, that bigger reform, when we're out of the most immediate danger.
I just wanted to bring in something that Lucy has said about Portugal, which is quite an interesting update. I mean, she asked a question as well, but she says, Portugal has just announced automatic status and access to services for asylum seekers and undocumented migrants after civil society lobbying regarding coronavirus. Is there work on a global call for this? I mean, I know Portugal has a rather more left-wing government than we do in the UK, but I know there's been some calls around those kinds of things already, and we are, I think, going to have a webinar on specifically looking at migration and coronavirus issues a bit further down the line. It's not organised yet, but I don't know. I just wanted to throw that in there because it's interesting. I don't know if any of you have got a particular anything to say about that, but
I think we should totally support that. If that, you know, and I think this is one of the kinds of things, one of the kinds of initiatives that will, you know, that all of us sitting in our separated from far away, this is the kind of internationalism that we can show. Because maybe in the UK, you don't have an internal migrant population anymore. What Thomas Hardy wrote about in Tess of the D'Urbervilles, you know, that was a long time ago. But in all Asian countries, we have those. In African countries, you have them. In Latin American countries, you have them, right? And migrants are being discriminated against domestically as well as internationally. And I think we have to push very, very hard for the fact that human rights do not stop at borders. You know, the rights of people, respect, dignity, the right to life, the right to services, the rights to all those things, all those facilities that ensure that people can live with dignity and provide for themselves with dignity, they do not stop at borders. And we can't forget that there is a huge debt that the wealthy and the privileged owe to the working class and to the food producers. You know, there is the North-South, there is the history of colonialism and the history of exploitation, which continues today. We see the results of that, you know, in fact, with structural adjustment and neoliberalism and so on. But we also now have a North in the South and the South in the North, you know, and this is where the precariat has come in. The precariat has become the South, the international South. And everybody who's even slightly privileged owes a debt to the working class and to the precariats. And many of the people who you know, our lives, the things we use in our lives, the food we eat, our lives depend upon the work and the, you know, sorry to put it this way, but the blood, sweat, and tears of the precariat. And we owe them. And I think, you know, what kind of people are we if we don't fight for this? Who are we? I mean, I think the only test of a governance system is how best it protects the rights of those who are most vulnerable. So I will strongly push for some kind of international campaigning and maybe, I don't know where it could go. I don't know whether resolution helps or whatever, but our governments have to change and our societies have to change the way we look at migrants and working class people.
Just on the migrant issue, I think JCWI, the Joint Council for the Welfare of Immigrants, is doing some really good stuff in this country. We're working a bit with Another Europe is Possible, who are also doing some positive stuff. Because I mean, Shalmali, migrants in this country have just been treated so badly in terms of public discourse for the last 10, 15 years, but particularly since the Brexit referendum, it's been absolutely awful. And now many of these people are absolutely in the front line. You know, they're working in the hospitals to treat us without proper protective gear. They're coming and delivering our food so we don't have to go out. I would really like to think about, and I would like to see how we can globalize this story as well, but how we can really get some of those voices out and humanize some of the stories of people who are in these jobs, because people's minds tend to change, I think, not necessarily through, for the majority of the population, through talking about the big structural issues, but through actually hearing the stories of the people who are on the front line. And I wonder whether we can find better ways of getting their voices and their stories into the public discourse.
Yeah, and I see somebody in the chat said that the Welsh government says they're going to ignore the no recourse to public funds rule for asylum seekers for the time being, anyway. So that's some small victory, I think, in the UK. And as you say, Nick, other people are organising for more for bigger demands. I just wanted to stay, because we are coming to the end now. In terms of doing things, people just to draw people's attention to the. One of the things we do in the activism team at Global Justice Now is produce a monthly update called Think Global, and sort of 4 times a year or 3 times a year it's a physical thing that gets mailed out to people, but it's also comes out monthly as an email, and it's a useful resource, basically. All the things you can do. We give updates on the campaigns and what the most strategically important things is that things are that people can do locally and so on. So just to flag that up, that's, again, you can find that on our website under the sort of under the get involved section. There's a act locally, and then Think Global newsletter. So we're coming to the scheduled end. We can just carry on very slightly. I suspect people will start to, because it is quite, we're spending our lives on online conversations at the moment, and you know, 2 hours is a reasonable length of time. So I suspect people will want to get onto other things. We're getting lots of thanks in the chat and what have you, so thanks for that. There's also been a few little interesting discussions going on in the chat. I could see that's great. But does anybody else, do any of the panelists just want to say anything finally, very briefly finally? I mean, I want to thank you all, obviously, for joining us, and thank you to all the attendees as well. I hope you found it useful. I hope some of you will come back and join some of the other webinars where, like Nick said, hopefully we can have a little bit more kind of discussion, and maybe discussion between people and so on. We're still experimenting with this format at the moment, so as lots of organizations seem to be doing. So but yeah, just finally, does anybody want to say any final comments, or they haven't had a chance to say yet, that might be important?
Well, I think for me, just a huge thank you to everybody for giving up part of your Saturday to listen to this. I know that everyone's got like so much to think about and worry about, and it's a very frightening time. I mean, the only thing I would say is that in frightening times, you know, the campaigning for justice and speaking out is more important than ever. I mean, these are the times where real change is necessary. These are also the times when there are real threats. You know, I'm really scared looking over at the United States at what might be about to hit them, and what Trump's reaction to some of that stuff will be. I mean, it's really scary stuff. But on the other hand, it gives us the opportunity to argue for what, you know, this organization's been arguing for many, many years and decades. And we can't give up. We can't give up. So thank you for being part of this, and keep up the struggle.
Well, from my side, I'd just like to thank you to Global Justice Now and to all of you for inviting me to join this. And I wish, of course, it had been more pleasant circumstances that we were all together having the big party for the 50th celebration, but hopefully that'll happen in the future. And thank you to all the participants who've been listening and supporting and giving very interesting ideas. I will write up my presentation or whatever notes and send them on, but is there a way to download this chat and send it also? James, is that possible? Because there are lots of really interesting ideas and links in this chat.
Yeah, I think we can certainly send it to you. I'm going to look at, I mean, just to say we have been recording this, but
right.
It records the chat separately, and I'm not intending to put the chat out publicly. I think that's probably because we didn't.
Okay, so maybe what I'll do is I'll just download
probably
the chat.
Send it to you, Shalmali. And
right. Yeah. And I'll also try and download the chat. But I think the other thing I just want to say is that, you know, things have been so tense and so depressing and discussed and you know, for the last several months. And I think I don't remember which famous union organizer it was who said, don't complain, don't get depressed, organize. And I think we have to do that. We have to seize the moment. We have the moment. This is a very, very good time to defeat intellectual property rights laws, to push for compulsory. I mean, there's a whole slew of things we can do, you know, together, North, South, in terms of solidarity, in terms of migrants' rights, instead of beating Big Pharma, and so not, you know, ensuring that we reclaim the space, reclaim the public. You know, we can do it. So that's my way of keeping my head above water. And also it's what we do. That's why we're activists. So thank you. And I look forward to working with all of you.
Great. Thanks, Shalmali. Anything
and stay well and safe, everybody.
Yeah.
Yeah, thank you. Just very quick to say thank you for everyone for joining in this morning, and I've really enjoyed reading your chats. It's just really hearing people kind of perspectives on the things that we've been talking about, people adding stuff to what we've been saying, people sort of raising questions. It just shows that the level of, it's really encouraging as a speaker to see that level of engagement and interest. So yeah, just want to say thank you all, and I really hope that you will continue to join us on our future webinars, because I think we can continue this discussion going forward.
Yeah, lovely. And I hope everybody's been able to hear at least most of, I mean, I know there's been a few people have had a few problems with hearing at some points. Maybe that's been different for different people, but I hope generally you've been able to hear. And thanks everybody. Thanks for your feedback as well. That's still coming through. But I'm going to ask Sam to close the meeting now. So see you all soon.